Having had two associates who passed away, one with good directives and one with another, I went to corporate management and I said, shouldn't this be a corporate responsibility? And so I go to Scott and say, with the experience you had, with all the people that don't know, this group is relatively educated, they've done their planning, it appears from the response earlier, but there are directives at the state of Tennessee. One can do it themselves without legal expense, and yet I could not get the corporate world in a couple, 3 attempts to be willing to take on that potential liability to educate others that really do need those documents. So any thoughts?
I think that's a great point. Well, I know we've had some informal discussions in our company about this topic. I'm not familiar with what the legalities are, but this is certainly an initiative that I feel very strongly about and have made it something that I put in the forefront of my life in having discussions with others.
Of course, what we're all hoping from this is that you all will go back to your workplaces, your places of worship, your book club, anything else where people gather, and you'll talk about this, and you'll talk about us, and you'll say, there are these people in Nashville that are available to come and chat with you. Sit down over coffee, come to your book club and talk about this instead of the most recent bestseller. The best way I know to do this is to talk to each other about how to care for each other best across the whole spectrum of our lives, but especially at the end.
I think the whole business about health literacy, including end-of-life planning, is a way to think about exactly what our panelists are talking about. It's just as important as knowing your blood pressure or your cholesterol level, or just as important as making sure that your health insurance is in good form and that you are choosing your healthcare providers wisely, in my view. And if we could get to the point in which that is just simply an accepted part of what people do, and perhaps community organizations and maybe employers would have a role in that.